Hello, everyone, and welcome. Welcome to Back Chat. Welcome to Move with Scoliosis, your channel for everything about yoga, movement for scoliosis and back care. Welcome if this is your first time here for Back Chat. So today we're actually doing a Q&A session, and I've got lots and lots of questions that we always receive in the Facebook group. This is a free Facebook group which you are more than welcome to join if you have scoliosis, if you have a loved one with scoliosis, and you're just looking for more resources and a little bit of a community and just connecting with some other people as well who have scoliosis. So you can find us there at Yoga for Scoliosis Community if you want to join us. So I'm answering questions from that today. And I can see there's a few of you joining me in the chat today. So feel free to come and say hello. Let us know where you're from. Let us know if you've got any specific questions. Now, a lot of the questions that I have found that I was going to answer today are about pain, because I think that is a really, really, really important topic, and it's something that obviously we're all concerned with. Nobody wants to have pain, right? So that is kind of going to be the general topic, but obviously feel free to use the chat. And if I'm looking to the side, I've got another device here where I'm just looking at the comments as well. So I'm not ignoring anyone. But yes, welcome. Let me know if you're hearing me okay. And just before we dive in, just a little reminder for those of you who are seeing my face regularly, maybe on Instagram, who's done already a lot of the videos, maybe my practice videos on YouTube. If you enjoy them and you want a little bit more accountability, if you're wanting to kind of continue with a weekly practice, then feel free to join us in the Shine membership. Now, we have a special offer at the moment for the next 2 days still, where we offer you the first month half price, which is £24.50 in pounds, which is an amazing deal considering that you're getting 2 live classes a week, and they are always recorded as well. So if you're not in the same time zone as me, you can catch up afterwards. We've got all sorts of workshops in there, so some great sessions with people like Ed Padgett, Meredith Weiss, who's a Schroth therapist, lots and lots of people who know lots of things about scoliosis and teaching us basically all the different approaches. And I think that is important. There is no one way that works for everyone. Unfortunately, we all have to find our own way. And yes, so for me, this has always been yoga. But more recently, those of you who know, I've been kind of threading in some more Pilates exercises because I found them to be very, very helpful in my body, which is also obviously we don't always need the same things at every age. We all change, of course, and we need different things at different times. Good. So again, feel free to let me know in the comments if you've got any specific questions. And otherwise, I'm just going to go through the ones that I've got in the Facebook group. Good. So one of the things I kind of came across just looking at different kind of chat rooms and things about scoliosis recently was this idea about pain is, or people going to see their doctor and then the doctor saying, well, scoliosis doesn't cause pain, this is in your head. So let me know if this sounds familiar to you, if this has happened to you. Like not being taken seriously, basically, especially as an adult. I think if it's a child, people are usually a little bit more interested, let's say. Hi, Liz. Liz is saying hello. Lovely regular here and Shine member or former Shine member as well. She's taking a little bit of a break right now. But yes, so this idea that you're kind of almost like making you feel like you're making things up, or this is not quite right, or you're imagining your pain. Now, nobody, why would you, right? Why would you want to imagine your pain? Of course, nobody wants to have pain. But what I would say to that, and maybe that sometimes, maybe health professionals maybe not explaining themselves properly what they mean with this exactly. But what I would say about this is that pain is always in your head. Always, always, always. So pain is literally, it's just a response from your brain because it feels that you are somehow under threat. So that is all that pain is. It's kind of a um, not a kind of a signal. Yes, it's a response to something threatening happening. And the job of your brain is to keep you safe, of course. The primary job of your brain is to make sure that you do not die and that nothing bad ever happens to you. So, pain is just one of the ways that your brain kind of helps you to react, basically. So, what this means and what it doesn't mean, what it definitely doesn't mean, is that there is always a threat. And we know this, obviously. Well, maybe you have experienced this in your body. For example, if you've got, if you're giving a speech or something like that, public speaking is one of the ones where we very often feel threatened. And maybe you've ever experienced nerves and you're starting kind of to sweat or your heart starts to beat really fast. This is a response, right? Because we feel under threat. So we know that there is a link and that it also doesn't always have to be something physical. So this could be something, the brain basically can't tell the difference if you're about to be punched by someone physically, or if your mother-in-law is saying something horrible about your new haircut. For the brain, this is kind of the same thing. So it feels like a stab, basically, or it feels like a punch. It's the same amount of threat. So we have to keep this in mind, that pain does not always mean that there is something physically wrong. And we know this because there have been studies and people have researched this. It's not like everyone who's got the same injury has got the same amount of pain. For example, about slip discs and things like this, there are studies which show that a lot of people actually have problems with their discs and even herniated slip discs, whatever, and they have no pain. And then there's other people that have disc problems and they have pain. So how can this be that some people have got pain and that some people don't have pain? So same thing goes for scoliosis. So we know that there is no direct relationship between, for example, somebody with a 60-degree Cobb angle curvature having more pain than somebody with a 20-degree Cobb angle curvature having less pain. There is no direct relationship there. Actually, I have found when working with people that it's very often people who have got a smaller curvature that actually have got more pain. So how does this help us? Obviously, maybe you're saying, well, Christine, this does not help me at all with my pain. Where is it coming from? All I'm saying is we have to kind of dig a little bit deeper, and it might not always be kind of what it seems. And sometimes having your x-ray isn't super helpful. And that might be a little bit counterintuitive. What I usually say, obviously, it's good to know your curve because then you can work with it. But sometimes people get really scared, right? If this is, especially if you've just been newly diagnosed, seeing your x-ray can be really, it can be scary, right? How, seeing this big curvature and how are you even walking around like this? obviously this can be scary, and this in itself can be a threat. So this can feel threatening for your brain. And I'm not saying that this scoliosis, that the diagnosis will then kind of cause the pain. I'm not saying that, but it might also not help in reducing the threat. So this is basically what we need to do. We need to reduce the threat to your brain that it doesn't start to give you pain. So how do we do this? Let's have a little look who's here. So Patrick is here from New Hampshire. Tracy is here. So she's saying, I discovered that I had an 8%, and I'm guessing that you mean a degree. So usually scoliosis is measured in degrees. And I don't know if you mean 8 degrees, because that would technically not be a scoliosis. This would be a very, very small curvature. When my spine curves, it's squeezing my sciatica. The professor who I went to says it's too dangerous to operate. Yeah, so sometimes, especially kind of very low lumbar scoliosis, things like this, can sometimes, if it's too close to nerves and things like this, they sometimes say it's better not to touch it and just to kind of leave it and manage the pain differently and manage the symptoms, which I completely agree with, obviously. And I'm not a spinal surgeon anyway, so obviously they know what they are doing, but surgery is not the only way to deal with this, of course. So Tracy is saying yes, so it was degrees. Okay, so Nyla, I don't know if I'm saying your name right, saying I have S-curve scoliosis. Let's bring it across here, where my lumbar is pushed in and my upper back is pushed back out. Any stretches to help? So you could be talking about two different things here. So you could be, and if I'm drawing in the air, I would be looking for at someone from the back, and it looks like your spine is curved this way, but it could also be that you're talking about a kyphosis, which is if I look at you from the side and your spine goes outwards and then inwards. So that is a very, very different condition, sometimes related, sometimes it goes hand in hand, but it's good to clarify this. So what do you actually mean? Is it a scoliosis? So that would be a sideways curvature. Or is it the kyphosis, where it's like looking from the side and like a rounding of the back and then an inward curvature at the bottom? So you might want to clarify this. So she's saying my lower half is 20 degrees, top is 100 degrees. So that sounds more like a scoliosis, of course. Okay, Liz is saying, yes, compression is painful. No amount of stretching lasts. Just have to rest, but don't want to rest. Have too much to do at this time of the year. Yes, everyone does, right? We just want to get on with our lives. We don't want pain, right? But one of the things I would say to this, and resting is good, especially if there's kind of inflammation going on and things like this. But if we come to this idea of that we probably have pain because of the threat, that might mean that maybe some movements or something that you're doing is causing your brain basically to freak out. So that's how I like to look at it. And that doesn't mean that you should just be sitting on the sofa and not doing anything, even though your brain might quite like this, right? Because then my goodness, you're safe. But in the long term, you're not actually safe, right? You are going to get problems, obviously. So we have to differentiate a little bit, and we cannot always take things too seriously what our brain is saying that. And I'm not saying to ignore pain, by the way. I'm saying that maybe it's not that one thing that I'm doing. Maybe it's a combination of different things that are causing my brain to freak out. And stress is one of these things, unfortunately. So having too much to do, and already kind of, if we talk about a bucket, a thread bucket, right? And you're having to do all these things. I don't know, maybe you're a carer, maybe you're looking after someone. Um, Maybe you've got all these things that you need to do. Maybe you've got children. Maybe you've got to sort out your garden. You're worried about money. You need to make sure that you've got your income. And then on top of that, you see yourself in the mirror and you're standing like this, and that already, so all of this together can give you pain, right? So we have to kind of be a little bit more holistic about these things. So it's not just one thing, probably, most likely, that is leading to the pain. If it was, then everyone who has got, for example, this, let's say 20-degree lower lumbar scoliosis and top 100 degrees that Nyla was saying, would have the same amount of pain, but that's not true. So I have worked with plenty of people over the last 8 years or so, and there are people out there who've got very big pronounced curvatures and they have no pain. And there's people who have got small amount of curvature and they do have pain. Again, this does not mean that they are imagining it and that it's, well, as somebody said, my doctor said, oh, it's all in my head. Now you can go back to him and say, yes, of course it's in my head, because it's the brain that actually creates that pain. But where is it coming from, right? So I want to go into one question, and I'll come back to yours, Nyla, as well. I want to go to a question from Kathy in the Facebook group, who's saying, I have developed stabbing pain on my hip to the point that I'm having to begin to walk with a cane. It hurts most when moving the leg out or up. I'm in my 60s and have dealt with scoliosis since 13. I have learned how to deal with the pain and just keep going through the years. But this pain has me feeling very debilitated. The doctor says I have some minimal arthritis in hip, but not enough to warrant hip replacement. Just so tired of dealing with the additional pain on top of scoliosis. Wondering if this is muscular pain as a result of a curve and body trying to compensate. How do you keep going so you can remain active? And I think this is a great question, and lots of different things going on in there as well. So first of all, I would say to this, hip pain and scoliosis, yes, they kind of go hand in hand. So especially if you've got lumbar scoliosis, or if you've got a very big thoracic scoliosis even, and you've got a compensation curve going on in the lumbar, the hips are also affected. So you can almost see it in this case, as a reverse Jenga tower, where we're kind of putting things on top, but we're kind of going from the top down. So if there is a curvature there, the body lower down compensates the other way, and then it compensates again the other way. So obviously the hips, they might be, and I did an Instagram post actually about this week, the hips might be tilted. They might also be rotated and even kind of twisted, and that one hip goes forwards and the other hip kind of tilts backwards. So there is a lot of things going on. Sciatica, somebody said before. So obviously if there's a nerve that kind of gets in the way as well, there can be lots and lots of things going on. So again, but it might just be one of the things, right? So it might not be that one thing that is creating your pain. It might be a number of things. So we kind of have to become a little bit of a detective here, and maybe notice when is your pain worse, when is it better, and also, after what I was saying about thread, I'm hoping that this helps. what other things are going on in your life right now that could be causing your brain to freak out and kind of think that you are under threat. So obviously, so Kathy wants to know, well, what do I do about this, right? So she's saying, how do I keep going so to remain active? And it's kind of what Liz was saying as well. So she's saying it's no amount of stretching is helping, and resting. Well, we know maybe in the short term this might be a good idea, but in the long term, we know that this is not a good idea. By the way, so if we come back to this idea about threat, what do you think happens if you do not move your body at all for long periods of time? Do you maybe think that it could be that if you then move, that your brain is going to freak out and say, well, this is way too scary for me. This is threatening. I'm going to give you lots and lots of pain so that you don't move. If you then don't move, things will start to not work so well anymore. So again, this is true, right? Joints can start to basically not function anymore. Things start to lock up. Muscles are like, well, if we're not being used, we might as well go. So it's kind of a vicious cycle here. So you do have to keep moving, but you might just have to change the way that you move, and you might have to change maybe the dosage. So there's a lot of things that we can tweak here, right? Maybe you don't have to do a 1-hour yoga lesson or 1-hour yoga class once a week. Maybe you do 5 minutes of a yoga, but do it every day. So maybe kind of looking at those things. So I would say to Kathy, how do you keep going and remain active? Think of maybe reducing maybe the amount of exercise if you think that it's too much, and also think about the things that you do during the day, right? So for example, I'm going to take Liz as an example. She's saying she's got too much to do this year, this time of the year, so she can't rest. Well, I would say to that, what is it that you're doing? So what are your activities that you need to do? Maybe you're doing a lot of gardening, right? Maybe you are working somewhere where you have to stand a lot and be on your feet for long periods of time. So what are those things that you need to be able to do? And then you can kind of think about, well, what does this mean for me? What do I need in my movement practice, right, to help me with this sort of thing? So obviously, if you are a professional gymnast and you're doing all sorts of kind of acrobatics, you're on your hands and you're doing gymnastics and things like that all day long, my advice will be very different to, for example, Liz, who's just saying it's gardening and housework, right? You will need different parts of your body, and you will need different muscles, of course. So let's take gardening and housework, for example. What happens, obviously, with our back if we're doing gardening, especially, and housework? Probably we're going into this type of situation here, right? So everything that you're doing is probably going to be looking down and lifting things. It's probably all kind of with your hands. Now, if you are very one-sided or one-handed, maybe you're just using one hand and you're kind of bringing in a twist in there as well. So what do you need, obviously, for your body? And it doesn't mean stop doing what you're doing. It just means, well, maybe if you're doing an hour of gardening, maybe you need to spend for every hour, and I'm just coming up with this number right now, maybe you need 15 minutes of resetting after this. For every hour of gardening, 15 minutes of resetting and looking after yourself afterwards or before, just to kind of make sure that your body can cope with this. And again, this very much depends on the individual, what exactly this might be. But obviously, if Liz is telling me she's doing gardening and housework, I'm not going to have her do lots and lots of forward bends in her yoga practice. She doesn't need to practice this. She probably needs to release her hip flexors because they might be short and tight. She also needs to open up through the chest. So these muscles, pectoral muscles, might be short and tight. The trapezius might be overstretched and weak. The glutes might be quite weak as well. So it's kind of thinking about all these little places and making sure that your brain doesn't feel under threat, basically. And obviously, what could this threat be of being in this position all day long? Well, your muscles are probably holding on for dear life here in the back, because you don't want to be falling onto your face and injuring your head and your brain. So thinking about it this way, I'm hoping that this helps. And again, it doesn't mean so Liz was saying no amount of stretching is helping right now. Well, maybe it's not the stretching that is helping in your case. Maybe it's a little bit more of the strengthening. And we've been doing this a lot in our Pilates classes. These are functional movements, right? So we are working on lunges, for example, getting down, coming back up, getting down, coming back up, because you will need this in your day-to-day life. And then we're adding a resistance band, we're adding some weights, for example, in there, so that you can then go off and do this in your day-to-day life without the brain kind of completely freaking out and saying, well, Liz, sorry, but you're just going to have to stay at home and sit on the sofa because this is not good for you. This is dangerous. So we like to take it a little bit with a pinch of salt, sometimes the pain. And again, I'm not saying to ignore it, but I'm saying to maybe dig in a little bit deeper, especially if you had all your MRIs and all your investigations by the doctor and they cannot find something specific. That might be wrong. Sorry, that was a lot of stuff there going on. Okay, so Laura is saying resting is great, is the key to me whenever I cross the line. And my restorative teacher always said this to me. You want to really know where that line is because you don't want to cross it, right? How can we not do something before we cross that line? So little dose of resting movement before it starts to before you kind of go further. Okay, Laura is clarifying resetting, not resting. Resting is good though, Laura. All I'm saying is don't start to avoid movement because you think that might make it worse. No, movement is good, but we might have to look at the dose a little bit. Okay, so right, Liz is saying have to set a timer for chores. Yes, I like that. So give yourself and I do this as well, right? Especially if I've got things that take a long time. I say I'm giving myself 45 minutes to do this, and then I stop and do something else. I can always come back to it. But it's actually more productive anyway as well. I'm trying to teach this to my husband, but he doesn't listen to me. Back brace helps, but try not to use very often. Use correct posture corrections. Yes, and I'm not. Yeah, back brace. Sometimes it's just easy and it's useful, especially if you've got something where you physically. I don't know if you know you're going to be 10 hours for whatever reason, sitting somewhere or standing up or doing one activity, and you need that support, then do give yourself that support, but you don't want to start relying on it. So laying over Swiss ball releases kyphosis and pecs. Yes, so Liz, you've got lots of options, right? You've got lots of tools there that you can use as well. Okay, let me come back to Nyla if she's still here. So it's an S-curve scoliosis, but when you look from the side, you can see the curve how you described. So I reckon that there, and we actually have someone in the Shine membership who was talking about this week as well. So there is a kyphosis and there is a scoliosis going on. And this ties in nicely with someone else in the Facebook group who also was talking about, who was sharing actually a picture. This is Sandra. She's saying, I got diagnosed with scoliosis. The X-ray says the curve is minimal, but why is my back so rounded with a huge rib hump and severe pain? So again, I'm going to throw a little bit of research there to you. While scoliosis doesn't seem to be like an exact science of pain and severity of the curve and bigger amount of pain, there is more research and confirming that a bigger amount of kyphosis does lead to more pain and disability, actually. So actually the kyphosis is probably worse than the scoliosis. And obviously we have to determine, so some of this hump that you're talking about could come from the rotation and the scoliosis. But I think, well, just looking at the pictures I've seen there in the Facebook group, it doesn't sound very likely. So it sounds more that this is actually coming from the kyphosis. And this is kind of a different way of working. So whereas, in our yoga for scoliosis and Pilates for scoliosis sessions, we do most things in a neutral spine position, and we work on elongation, we work on strengthening, resetting, obviously, as Laura mentioned as well. For kyphosis, you kind of need that mobility, first of all, before you can start to kind of strengthen things up again, and before you can start to lengthen even. And anyone with locked kyphosis knows this, right? If somebody tells you to stand up straight, you're probably just bending into your lower back and think that, and just maybe even just lifting your chin, but nothing is actually happening in your thoracic spine because it might be really locked up and immobile. So we kind of have to release some of that tension and that tightness first, mobilize, and then you can start to lengthen, and then you can start to strengthen as well. Good. Yes, exactly. So yes, so kyphosis, and again, Nyla, sorry, I keep being distracted from this. It's kind of two different conditions. But what I would say to you, if you only have the kyphosis when you're looking at yourself from one side, and then when you're looking at yourself from the other side, it's not there, then that is the scoliosis talking here. So, and especially if you're saying that your thoracic scoliosis is 100 degrees, that is a severe curvature. And then so it's very likely that obviously it could be from that. Good. So obviously you were asking which stretches would help for that. So again, it's very difficult for me to recommend anything in particular without knowing anything else about you. So there's a lot of things I would ask you. I would ask you, what are the type of activities that you do during the day? I would ask you how old you are, when you were first diagnosed, where exactly where you're feeling pain. If you are feeling pain, you might not be feeling pain. So I would need a little bit more information. But in general, anything that elongates you, that lengthens you out, is going to be good. Obviously, if things are really tight and locked up, and if it has been for a long time this way, we might have to start a different way, and we might have to start to release first before we can make those changes. Good. Mini Monster, hello. I visibly from the front, let me bring this up here. I visibly from the front have left ribs that stick out on the right, and I have a deeper dip on my waistline. Is that from scoliosis? Possibly, if you have you been diagnosed with scoliosis? Then, well, yes, that could be from your scoliosis. That would be some of it, the ribs sticking out could be from the rotational component. So remember, when there's a sideward curvature, there's always a rotation as well. So that could push your left ribs forwards. And then obviously the waist might be that the sideward component. So that maybe your convexity is on one side, and then where you have your concave side, there might be a little bit of a dip. Having said this could have other reasons as well. For example, are your legs the same length? It could be a leg length difference, which wouldn't explain the rotation necessarily in the ribs, but it could have other causes as well. Okay, I was told I had scoliosis as a child and wore a brace, but just to keep my shoulders back. Okay, so yes, and it kind of, again, it depends on how old you are and when this might have been that they have given you that type of brace, which country you are in. Again, the approaches tend to be different. But maybe at that point, they were more concerned about the kyphosis and that they didn't want you to start kind of rounding forwards, and they wanted you to be more upright. Maybe that was the only way that they could kind of think about of correcting or helping you with this. But I would always say there should be some sort of physiotherapy movement practice along with the brace. It's not enough just to have a brace, in my opinion. Good. So I hope that helps you in any way. Obviously, again, in terms of what we do about this, there might be different ways, obviously, of approaching this as well. Good. Let me see if we've got one more here in the Facebook group. There was one more about pain. Okay. Ranjana is asking, I was diagnosed with scoliosis in my teens and wore braces for 3 years. I never had a problem, but for the last 1 year, I'm having back pain and have severe pain after getting up from bed for a few hours. Otherwise, I'm fine. I don't know how to manage the pain. So I'm hoping everything that we've kind of said before already has helped you as well. So diagnosed with scoliosis in my teens. So how did this? I'm going to go all psychology on you here. But how did wearing a brace for 3 years in your teenage years, how did this affect you? You know, how did it make you feel? Do you still think about the brace sometimes? Do you still feel like you're missing something, like you need the brace? I'm just, throwing things out here. So wearing a brace can very much kind of add to all your bucket. If we talk about this bucket of threat again, it can add to this. It's traumatic, right? It's a traumatic experience, and I'm not against it. A lot of kids absolutely need a brace to get them through those growing years, obviously, where they grow really quickly, and help them to make sure that the scoliosis get worse. But um, we cannot expect for everything just to be completely going back to normal after wearing this plastic thing for 3 years while your body is developing as a teenager, and you've got enough problems going on, right? There's all sorts of things going on in your teenage years. So I'm throwing this out there to help a little bit with not just making this about one thing mainly. And not that Ranjana has been doing this at all. She's just saying that um, it's in the morning. It kind of she needs to get going a little bit, and she hasn't got any problems otherwise, and we don't want her to have any other problems. But obviously, what I would say to that obviously is have a little bit of a routine in the morning. Give yourself time, give yourself some self-care right before you start your day. And again, this is a signal, or it's something that your brain perceives to be a threat, and maybe that's being static for a long period of time. So when you sleep, you are in one position, right? Maybe your brain is like, this is not good for me, or it's not good for you, so I'm going to give you pain. So, what are the things that you could do in the morning to release that type of pain? So, experiment a little bit, but we've got plenty of practice videos here on this channel, gentle morning movements, things like that. I think there is even a yoga practice called morning practice for scoliosis. Start with that, right? And then see what's helping you. You might have to look at the way that you sleep as well. So again, there are some videos on this channel about sleeping positions, and I'm experimenting this in my own body at the moment. I'm trying to get myself to sleep on the back, which is not the easiest thing, I can tell you. But I basically noticed that I got myself into a lot of rotation when I sleep. So I'm trying to be a little bit more in a neutral spine, and trying to sleep on my back, but it's not the easiest thing. I'll keep you updated on that. But these are just a couple of things that you might want to look at, right? So the way that you sleep, how you feel about your scoliosis in general, and then what can you do to look after yourself, right? So we don't have to be jumping out of the bed straight away and feeling all amazing, right? So again, it's a signal that maybe you need a little bit more time. Good. So Liz is saying your videos and guidance are very helpful. Thank you. You're welcome. Good. Mini Monster, I'm going to try and say this word. Could costochondritis be caused by scoliosis? I have no idea what that is, I'm afraid. So itis is some sort of inflammation, but I don't know. I'm not familiar with that condition at all. So sorry about that. Good. Just lifting my chest up helps greatly as well. Is Liz saying this? And this is obviously Liz who's saying she's doing a lot of gardening and housework. Yes, it's opening up that space here. All these things will be great for you and help you personally with your resetting and whatever that might be. But it might also be thinking about, maybe bringing in some, again, if you're telling me you've got too many things to do, that you don't have time to lounge around, kind of a warning signal to me that maybe you do need to slow it down a little bit. Again, it doesn't mean lie on the sofa, but maybe bringing in some pranayama, maybe bringing in some breathing practice into your yoga as well. Okay, so inflammation of the chest wall, very painful. Okay, so yes, I'm sorry, I'm not familiar with the condition, but obviously scoliosis, can have an effect on the whole body, right? So it's every part of the body that is involved here. Is your Pilates training still ongoing? Sorry if I missed it earlier. So yes, so Pilates is very much here to stay in the Shine membership. So we've got Sunday sessions. We don't have it this week because it's Easter, and I'm going to Germany tomorrow morning. But in general, yes, we've got a Sunday evening session, slightly shorter session, so 45 minutes, which I think is great and just the perfect amount of time because it's a little bit more active and it's a little bit more, we use our weights, we use the resistance band, we use props. So I feel like this is the perfect amount of time for it. And you can feel it, right? And you feel that you have done some work. But yes, so that is here to stay in the Shine membership. If you are not a member right now, but you would like to join us, for the next 2 days, still, you can get your first month at 50% off, which is £24.50 in pounds. And it's a great way, especially if you are kind of relatively new to all of this, but you do want to kind of get into a regular habit of practicing, then this is a great way. So yoga and Pilates, any movement practice is only going to help or create a difference if you actually do it. If you're just watching videos or reading about this, it's probably not going to do very much, I'm afraid. So this is why, the Shine membership is there, because scoliosis doesn't go away, I'm afraid. We might improve certain aspects, we might move better, we might be able to improve the posture, but the scoliosis pattern will still be there. So we kind of have to keep going and working with it all our lives. Good. So Liz is saying she's enjoying the Pilates session. Excellent. Lovely. So I enjoyed this chat. Hope you did too. Thank you so much for all your questions. Thank you so much for being here. And yes, join us in the Facebook group. Join us in Shine if you're more committed, if you're committing to kind of a regular practice. And yeah, I hope to see you very soon, and keep your questions coming. Thanks, everyone.